Well, Back by Popular Demand is another small behavior segment. One issue that I often have parents ask me about, and the therapists have asked me to speak about, is some of the causes of behavior. I think we oftentimes assume that if our children are having behavior issues, that it's either and normally with kiddos it's just a stage they're going through, but with many of our kiddos that have continual behavior, we have to look at what's causing it, and sometimes there's multiple causes that we have to consider. Sometimes there's biomedical causes, there's dietary causes, there can be allergies that can cause behavior. There can also be, outside of medical conditions, there can be just a behavior pattern that's been reinforced over time. And so, because it's worked, when something works, we continue to do it. And that's just basic human nature. But one thing I want you to consider when you go to any therapy outside of behavior therapy itself, that if your child is experiencing a lot of problematic behavior and you're not sure whether it's sensory based or it's medical based or what it is, it's real important to investigate that, because if we're starting your child out in therapy and there's a lot of behaviors and they're not sensory based, once we get rid of the sensory problem, if the behavior's persisting, there's a reason, because there's a reason for everything. But understand that we're continuing to battle with a behavior which is really taking away from our time of doing OT with your child. We're very well trained in behavior and can do it, but I think you're coming because you want that child to be functioning better on their OT goals. So it's just going to take us longer. So many of our parents have found that they're either putting behavior strategies in at home, they're working together with their therapist, because we won't extinguish a behavior if one person's expecting one thing and another person's expecting another. It has to be very consistent. That's the only way you extinguish a behavior. So you have to be a team. And sometimes a component in that team may be a behavior specialist of some type. So those are things to consider. We do know that children with behavior issues or sensory issues can have behavior problems coming in to a sensory clinic. But if you're not seeing those go away quickly, we need to relook at that situation. So make sure that you're looking at that and considering that when you come in and you're working with your therapist on that. It's just a few points to think about.